So Dan and I were scuba diving up North Shore, and you have to navigate across some rocks to get back on shore. And in this particular situation, my right foot wasn't solid on a rock. The right foot slipped off the rock, and I went to brace myself with 40 pounds of gear on my back, and my right arm went right between two rocks and twisted behind me.
She had a really bad humerus fracture. So Ed Weldon he's our shoulder and elbow expert. No matter how complicated it is, he's really the person that you want to see.
Dr. Weldon said to me, I don't anticipate any problems with this surgery, but if something comes along and we need additional help, I need you to understand that the doctors at Straub aren't the guys that just see each other in the hallway every day or see each other in the doctor's lounge and have coffee. We're brothers and sisters, and if I need help, my brothers and sisters are going to come running. And if you need a cardiologist or you need a neurologist or whatever you need, I will have them at your bedside and they will help us.
So when he realized exactly the extent of her injury, he approached me and we talked about it. We went through all the scenarios because we really didn't know how bad this was. But it really was nice to work as a team and try to figure out the best plan to take care of her.
This was something that was much more technical if we're talking about a surgery, and he took the time to make sure we understood what it was and answered all our questions, even down to, nerves. Well, how are you going to connect the nerves? How do you do that? Well, here's how I do that. I feel like I could actually do the surgery at this point because he explained it in that much detail.
The more that a patient knows and understands, the more you involve them. No matter what the surgery is, the better the outcome. People want to feel like they understand and they have a choice. For her, she had a segmental loss of about 6 centimeters, so the two ends of the nerve couldn't talk. The brain and spinal cord is saying move, but the wiring wasn't getting through to the muscles, so nothing would happen. So the surgery is basically reconnecting these two wires and creating a cable so that that signal can pass through.
Well, interestingly, we came in through the outpatient process, and yeah, it was right there in that bed, and I was, they had prepped me for surgery. We were just waiting to go in, and Dr. Chen came in and said, I have some people I want you to meet. And he brought in, I don't know how many people at that point, and he said, I want to introduce you to your surgical team, and they're going to tell you who they are and what their role is in giving you excellent patient care. And just hearing from that team what they were going to do to keep me safe and give me the best care was so reassuring that I just didn't worry anymore.
JP and Peter are two of my trusted people that I work with a lot.
We had a plan about everything before the surgery, so we were already ready for everything. Plus,
every aspect of what we might face or needed to do was covered in our planning.
We all know what the craft of surgery is, but the extra mile of getting patients to understand, answering their questions, and making them feel comfortable. When you compare those two things together, the technical aspect and like the emotional aspect of having to go through something as traumatic as surgery, that's kind of the holy grail. That's when people are happy, when they get both sides of the experience.
I'm comfortable here at Straub. I would bring my granddaughter here, and that's probably the highest compliment I can give somebody.